basically, I was telling you about the overview of the exam. Just have a quick review again. Listening, we have 42 questions, 3 parts, 24 in part A, 6 in part B, and 12 in part C. Passing score is 350 for all of the professional. Reading, we have 3 parts, 15 minutes for part A, 45 minutes for part B and C. So we have 20 and 22 questions respectively in part A and then B and C. Passing score again 350. Writing is profession specific task. We have 45 minutes time in total. And like for doctors, for UK, Ireland, Australia, passing score is 350. For nurses, it will be 300. Then we have speaking session. There will be 2 cards. They are profession specific, and you will be getting those 2 things, the profession specific task over here, right? So 2 role play card. The first one is the clinical and the second one is the linguistic skill that will be tested. Sorry, these are the 2 skills that will be tested over here. So basically, we just have a quick review of the listening part. In the listening part, again, we have 2 extract, 12 question per extract. Like that, they're gonna assess your ability to extract the specific information from the text during the conversation. You hear a recorded healthcare professional to patient consultation, and you need to complete the notes from the conversation, right? The possible challenges that you may face, the first and foremost is the speed of the conversation. Not only the listening or the conversation speed, but at the same time, you have to write down the answer and you need to match your pace of listening, writing, and following the text. The second problem that you may encounter is the accent issue. There could be variety of accent, which includes Australian, British, American, New Zealandian, Irish, and so on, right? These are few accents. Okay. These are the few of the accent that we should have. And then we have the like tone problem. Sometimes they just dip the tone. So you must have active listening skills. So you may not miss anything. So for example, for the sake of example, these are the types of question you can see, as I mentioned earlier, notes completion. So what you're going to do is, first, there will be a background statement. You hear a physiotherapist talking to a patient, right? And the physiotherapist, we can go on notes quickly and we can find, okay, sciatica is the problem. Now you are talking to physiotherapist with reference to sciatica. Now we can see the notes accordingly. And we can predict certain question, maybe location, description, right? Can be predicted. These are few things that can be predicted over here. Okay. Then we can see application of something, let's say, it can be predicted. Maybe. So you can just have a quick look to the notes and you can predict most of the answer. So you'll be having 30-second time to read your question. And after that 30-second time, you can, we can say, you can make the notes. And then they'll play the audio and you can write down the answer over here. So in 30-second time, mark some important keywords. When the audio will be played, just listen it carefully. Do not get distracted. Mark the keywords. Try to follow the pace along with that keyword, right? So plus point is that you need to be phonetically correct. As long as you are having basically, phonetically right, the answer will be right. What I mean by that, if your answer to the question is, for example, what I can say, if your answer is pneumonia, let's say, with this spelling, and if you have written pneumonia, let's say, if you are breaking, although you can write in one word, but let's say to understand, if you're writing in this way, pneumonia, can be written in this spell, it would be right from the spelling, pneumonia, from the spelling, from the sound actually, it will be right. Similarly, if there's narrated chaotic and you have written as chaotic, right? So it will be right answer if it sound right. Anyhow, so basically what we can do is in this listening part A, we must be phonetically correct. We must be phonetically correct. As long as you have a phonetically correct answer, this answer will be considered as right answer. So there will be two extract like that. So two different healthcare professional to patient conversation, such as physiotherapist patient here, such as doctor patient, such as nurse patient, pharmacist patient, and so on. So there could be variety of conversation that we can practice in our practice session over here. And in the exam, you'll get two such sessions in listening part A. It's comparatively one of the easiest section, and we should make sure that you should get 24 out of 24 in this part in order to get a high passing ratio over here. And assure us with that you will pass the exam if you get 24 out of 24 over here. There is a high probability that you'll pass the exam. Anyhow, so followed by part B of listening. In part B, that will assess your ability to understand the main idea or the gist of the information or the detail maybe, and at time the purpose of given short extract. The information has been sourced from the healthcare workplace different settings, such as mostly the patient handovers. You can say it could be a morning briefing, or like say inductions, for example. Let's say it could be a dialogue between the healthcare patient, maybe doctor patient, nurse patient that we had in the part A. At the end of each section, you will be given one multiple choice type of question and you have to shade the answer. The first one is a background statement that will guide you where you are sitting in at the moment. Then we have the main question that is the main concern about. And then we have three different statements. Negative point about the multiple choice type of question is that they will speak each and every option. This is the negative point. So it would be difficult for you to select the right answer under pressure of time and exam, and at the same time when the audio is played, right? Anyhow, so we have to look for the main thing, that is warning. What does she warn her colleague about? It's not necessary that they would use the word warning. It's not necessary that they would use the word warning, right? Okay, so we can see there, let's say we have the warning thing. The patient, what does she warn her colleague about? Let's say it's about the antibiotics, it's about the falling, and it's about the breathlessness. So we have three different options that we have had over here. So we can see there, like when they'll play the audio, as I mentioned that this is the negative thing, that they will speak each and every options. So what you can do is, we have to listen it carefully because they may use a part of statement, or even let's say they speak the A statement as it is, but it's not a warning. So you have to be careful that answer to the question, it has to be answer to the question. And secondly, they might not use the same word or phrase. They can change maybe with just change the must with may, maybe may with must, and so on. So you have to be carefully listen to the conversation and do this thing with the rule of elimination. So there are 6 questions like that. So before each question, they're gonna give you 15-second time before each question, right? And after each question, we have, you can say, 5-second time to share the answer. So after listening part B, they will move on toward the part C. In part C, these are again recorded conversation, such as interview or lecture or maybe the presentations. Mostly information has been extracted from the research-oriented or academia-related articles. This part will assess your ability to understand the purpose or opinion of the conversation, right? So there will be a statement first. You hear a conversation between, let's say, blah and blah, talking about blah blah issue. The issue has been written. Then it would be written, let's say, they will giving you they will be giving you 90-second time to read these 6 questions. Then the audio will be played. Let's suppose the question is, why does Dr. Robson regard as a Chagas as a neglected disease? So we need to find the reason of neglection for the Chagas. So when the audio will be played, you can see that they will speak all these 3 options. But maybe the one of the option might not be the reason of neglection. It might be the description of disease, let's say. So and secondly, whenever they will describe you the reason of neglection, you have to select that. Information will be highly paraphrased. So 6 questions like that. Then we have a second extract in part C. Again, you'll go with the same formula. At time, we have one section is dialogue, that is comparatively easy. And second section is monologue, that is comparatively difficult. Anyhow, so these are some of the information that we have discussed about the listening part. So some frequently asked question of the listening, that we have 42 questions in total. There could be a variety of accent, and you have to write it down on the question paper, because this is the question paper and this is your answer sheet. There is no extra or separate answer sheet is being given to you, right? So we can see that you have to be careful about your spaces, that you should write it down exactly in front of that given space of the question. Do not mismatch it. For part B and C, you have to shade the answers. And do remember one more thing, that as we discussed earlier, that you will not be having any penalty for spelling mistake, right? And for paper-based exam, you will be given 2 minutes time to check your answer at the end of the session. However, for computer-based exam, you will be having some time between each section, section 1, 2, 3, like that, right? You should not add something that is not in the audio in part A. Do write it down what you hear. Do not change it or do not add from yourself. You can use these standard abbreviations, as is one of the frequently asked questions. Do use that those abbreviations which are standard, not related to only one specific domain. You should not write it down something that is not in the audio from your knowledge, right? And as we discussed, passing score is 30-32. Followed by the reading subtest, part A, we have 20 question, 15 minutes, and the first area is specifically focusing on your skimming and scanning skills. As you can see, there will be 4 texts. And what do you mean by scanning is to mark some keywords, as you can see, that has been done. Whatever you believe is important, you can mark them. And skimming means that you have to read the first 2 lines or the last 2 lines of the paragraph, or understand or give the subheadings. So in simple word, scan is to look for the specific details such as keywords, and skim is to, I would say, is to give subheadings to the paragraph and try to understand the main crux of the paragraph is called as the skimming. Okay, so in these 4 paragraphs, you just have to make a main crux of the paragraph. Then you can see the 1 to 7 question, they are matching question. You have to read the question and need to make sure either it's A, B, C, and D, matching question, right? Then we can see we have 8 to 14, like these are those questions where we can see that we have to write it down a word or a phrase. If exactly the text, exactly same thing from the text, you have to write it down, a word or phrase, right? So whatever you believe is appropriate. However, in the last part, that is fill in the blanks, in this part, you have to keep one thing in mind, that information that you will be writing in fill in the blanks, it has to be grammatically correct. So you have to be careful. If it's a noun, sometimes we have to change to adjective. If it's adjective, sometimes we have to change to verb and so on. So basically, as per the requirement, you have to change the form of the word over here, right? After 15 minutes, they will take this part back from you. So first, we have some time to look the question and then have a quick review to the text. After that, we can start from question number 8 to 20 first and 1 to 7 at the end. However, it's vice versa. It's a vice versa thing, okay? Okay. So is it clear to you? So anyhow, so basically, then we have part B. In part B, we can see there will be 6 texts. Let's say 100 to 150 words per text, different healthcare related topics, 6 questions such as policies, work-related emails, instruction, guideline, manuals, and so on. Now, parts B will assess your general understanding of the text. What's the purpose or the gist or generic overview of the text given? The answer option will be paraphrased. Most of the answer, such as will be either in the topic sentence or in the conclusive sentence, but do not make this thing as you can say as a landmark for yourself to do the part B, no matter what. At time we have to read whole text. We might not be able to get an idea the whole text, right? At time we need to read the whole text, but for part B, as you can see, if it's such as if the writer is asking you what is the purpose of this text, for example, right? So what is the main idea of this text? Sometime these could be in the topic sentence or conclusive sentence, or what I would say is that focus on the tone of the paragraph. Whatever thing that they are emphasizing, that would be the answer. Mostly in part B, the thing that has been stressed in the paragraph, that would be the answer. Anyhow. So you can see that it is policies, work-related emails, instruction guidelines. So genre over here is totally related to professional related genre that we have to follow in our professional communication. So there will be strategy that you have to practice is the elimination method that we'll discuss further in the classes. But if this, you can see this is a question, right? And these are 3 options. So from the text, you have to confirm that which one is right. So you need to negate, let's say, first 2 to select the right one as an answer, right? Anyhow, so from the given extract, you have to make sure, okay, according to this manual, what is the best answer to this question? According to the given information, not from your knowledge. Remember that. From this given information, it's not, they are not testing your knowledge. From this your given information, you need to derive the right answer for this question, right? So there will be 6 questions like that. There will be 6 questions like that. And after that, you have to go for part C. In part C, there are different aspects of healthcare related topics. There will be 2 extract, 8 questions per extract, and we have 700 to 800 words per extract. There are different topics from the healthcare, such as ADHD, such as, let's say, Alzheimer's, for example, such as, for example, we can move on and we can discuss about the sedation, for example, SARS, for example, and so on, different topics we can have. Anyhow, there are 3 different nature of question. The first question is explicit meaning. Explicit meaning means there is no little paraphrasing. The second type of question is inference meaning, as the name indicate that you have to infer the answer. And the third type of question is vocabulary based, right? So we have to learn those 3 type of question, and the idea of elimination should be learned. Reading part C, you can see there we have this type of text, let's say a lengthier text around 700 to 800 and 1000 words per text. We can see there in the first paragraph, the writer use everyone cater words too. They're asking you that why word has been used. So from the text, let's say, if the format is, they'll give you text, then we have, let's say, 7 to 8 questions. So from this text, you have to find the answer. What is the right answer for that? So we have different question in reading part B and C, and we have to have at least 2 minutes time per question for part B and C together. It's comprehension and it's comparatively bit challenging. You need a lot of your practice and intensive practice, I would say. But whatever your profession is, as of today, if you improve your language skill, okay, like either reading, listening, speaking, it will help you back when you start your job, inshallah, with the your employer after going through all the steps. Now we have next session is the writing subtest. In this writing subtest, we have 45 minutes time in total. The first 5 minutes is your reading time. In this time, you are not allowed to write anything anywhere, and even you're not allowed to mark anything anywhere, right? Then we have 40 minutes time to complete your writing task. You can write, you can read, you can mark, whatever you can do in this time. There will be one profession specific task. There will be only one profession specific task, only one letter that has to be written. It's a typical workplace situation that we all could encounter in our daily life, such as referring a patient, discharging a patient, or updating any healthcare professional on anything, or transferring a patient, or requesting any healthcare professional for specific facilities, right, or specialties. So these are different healthcare related, we can say, letters that you can have to write. So we have 6 points that you should keep in your mind when you're writing a letter, which include your purpose of writing. In simple word, why are we writing this letter? Which include your selection of case notes. It should be relevant selection that has to be done. We should have organization and layout, like where to write which thing. That is called as organization and layout. We have uh, conciseness and clarity. So summarize the less important detail. We have genre and style. We can see that genre mean again the mode of communication, the language selection, the politeness in the tone, and do not use the same word that has been used in the case notes just to change it. Let's say if in the case notes, if it's written hearing voices, and we are writing this letter to a specialist or a doctor, so we can use the hallucination and so on. And then we have the last part is the language part. In the language part, we have tenses, we have sentences, we have parts of speech, and so on. So in simple word, it's a writing comprehension. You will be given a case notes, like a case history, and after just like that, there's a case notes. You have to read the case notes and write down the answer like that in this format. Anyhow, we'll not be having a detailed review over there. So you'll be given a case note first, and you have to see, okay, this is the information in the writing task, and you need to write it down over here. Like date can be written over here or over here as well, and so on. Doctor name or the recipient name, whatever or whoever is being receiving this letter. Then we can see the designation, then the hospital city address, and so on. And this is RE stand for regarding. Then we can write down the patient name, then date of birth, and so on. Afterward, we can see that this is the letter format that could be followed, which includes your introduction, your purpose, your social plus past medical history as per relevance, relevant treatment record, today visit, conclusion, sign of statement, and so on. So you can see in any of the letter, we can write it down in this way, the writing task, right? So most important thing to learn is to learn about the writing structure and marking criteria. Anyhow, so for the speaking subtest, we have 15 to 20 minutes time for speaking. First one is the warm session. They can ask you some general question about in the warm session, about your name, about your hobbies, about your profession, why OET, and so on. Preparation time will be 2 to 3 minutes time for preparation, and then we have 5 to 6 minute time is counseling time, right? So 2 to 3 minutes time is for preparation, and 5 to 6 minute time are counseling per card. So this is the structure that you'll see in the card. For example, medical history, then treatment record and so on. We have clinical skills, which includes your personal relationship building skills. We have to be attentive. We have not to be like explore the patient concern before we can make any judgment. Then we have empathy. It should be, we can say, you should be empathetic. Then we have patient perspective. Explore the patient ideas or concern. Picking a patient cue that you can see from a bare eye, and then design a consultation with reference to patient response. Then we have information gathering skills. In the information gathering skills, first of all, you should show your active listening skills by not interrupting, then open and close ended question, and then we have providing skills and so on. Similarly, we have linguistic skills. So based on that, you need to practice your card. So this is your speaking card, let's say. You can see on the top left corner, you can see the history component. This is already information that you already know. And these are the tasks that has to be achieved, right? So in this speaking part, first of all, there are some frequently asked questions that you will be given 2 to 3 minutes time to prepare the card. You will have paper and pencil. You can take the notes. This card will remain with you. It's not necessary for you to make an eye contact. Then they will start recording. And you have to speak for at least 5 to 6 minutes time per card. Once the time will be finished, they can ask you to stop and move on. Okay. And then same setting will be repeated, like 3 minutes time for preparation and 5 to 6 minutes time for counseling. So in the preparation or counseling time, the card will remain throughout with you, and you can make a notes with the pencil, right? Anyhow, so this is about speaking, reading, listening. So if you like to ask a question.